As for today, we have 12,487 cases confirmed in Montreal. It is 563 new cases in the last 24 hours, more than 1,000 deaths, most of them, 80% of them in the context of CHSLD and residency for elders. When we're looking at the new hospitalization and in intensive care unit, we see a stabilization or a plateau since last week. This is quite a positive indicator for us. But what we see also is that certain neighborhoods have an increase in the number of cases that is more pronounced than other neighborhoods in the last weeks. As we see in Montréal-Nord, Saint-Michel, and Rivière-des-Prairies. So we had a lot of questions about Montréal-Nord in the last weeks. So I will do a little update on what we are seeing and what we are working with the people in this neighborhood. So as for today, we have more than 1,153 cases confirmed. It is the neighborhood with the most, the higher rates. It is a progression that we've seen since the 8th of April, and more than 40% of the cases are associated with CHSLD, RPA, the outbreaks in those places, or health care workers. And we have a higher proportion of health care workers. That 23% of the cases are health care workers, and we see in other neighborhoods that it is quite less. It is around 15%. And the cases are, we have more cases in the adult population. We also have some outbreaks in this neighborhood, but in workplace, in which we are having interventions, and we have not seen specific outbreaks in specific neighborhoods in Montréal-Nord or in specific buildings. We're working with the arrondissement and with the community partners to reinforce some strategy to make sure that distanciation is well applied, to make sure that workplace have all the tools to apply the recommendations, and we're looking at a strategy to screen to have a specific screening strategy in this neighborhood in the next days. I wanted also to talk about the Montreal strategy for deconfinements or to reopen certain sector of activity. What we want for Montreal is that we reopen in a secure manner and that we have a success in the reopening, so we do not have to close again. And Montreal has specific characteristics that we have to consider. We have a high density of population. Of course, we have public transportation that that poses an issue, and vulnerable population that we have to consider in our strategy. And so we're working with the government's orientation to make sure that conditions that have been well documented in the literature are in place. So we have to make sure that the transmission is well controlled. That's what we're going to do in certain neighborhoods where we have a suspicion of maybe a sustained transmission of the virus. We have to make sure that our healthcare system regains its capacity. We have to make sure that our public health system is able to manage an increase in cases if we open certain sector, and we have the capacity to intervene when there are outbreaks. Of course, we have to make sure that the workplace that are going to reopen have the capacity to put in place the measures and the recommendations that we are going to put. And of course, we need that the population be engaged in maintaining the distanciation, the 2-meter distance, in maintaining, of course, all the recommendations around gatherings, and the new recommendation that we have is the couvre-visage, I don't know in English,
face covering.
Face covering. That is not the same thing as a mask that we have in the healthcare facilities. And this is a recommendation that the government launched last week, or with knowing that with new, knowing that asymptomatic person may, we have a certain percentage of the population that can be asymptomatic and that can spread the virus. It is a complementary measure to other measures that we know of, washing your hands and keeping your 2 meters. But we think that at a population level, we should wear those masks in public places in Montreal, knowing the density of the population and the increased risk that we have in our urban region. So we ask the population to wear them when you know that it is going to be difficult to respect the 2 meters in public transportation, in at the grocery or pharmacy, and of course in workplaces if you know that the 2 meter is going to be difficult to respect. So I want to say that we know that it has been now more than 8 weeks that we're in this pandemic in Montreal. We know that it is hard. We have to adjust ourselves. The spring is coming, so we want to go out and socialize a little bit more. But we have to do the things really well to make sure that we do not have to reconfine in a couple of weeks. So we really ask, and we think that it is together that we're going to have success in our strategy of deconfinement. Thank you.
Thank you, Dr. Drouin. And on my side, I definitely want to speak to you about the gradual economic recovery plan announced by the government of Quebec earlier today.